Hey guys, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. Today, we're going to talk a little bit about IV site locations. Not going to go into actual IV starting or anything like that, but I just want to kind of just point out some of the anatomy, because I really think that when you know where you're looking for a vein and where you're looking to start the IV on a patient, it's going to help you be more successful. Now, the patients we get aren't always these 20-year-old athletic type patients who have nice big pipes, nice big veins that we can easily access. You don't even need PowerPoint presentations like this. You don't need to do skills. You can see the vein, and you know that you can probably stick that vein from across the room, right, and get IV access and be successful. But most of our patients aren't really like this. So I think it's important for us to really understand and to kind of refresh our memory and just sort of go over once in a while where IV site locations are and where we can try to start intravenous. Now, of course, we have to think about IV access as well. And when we talk about when we start the IV, try, guys, don't start IVs that are distal to a spot where you have failed. Okay, because you might have actually blown the vein above that distal location, and even though you might get access, the patient's not going to get any benefit from it, right? This is why, when you learn IV access in school and in classrooms, they always tell you, always start lower on the patient's that extremity or wherever it is that you're trying to start the IV. Just a quick tip there, just to kind of keep that in the front of your mind when you're starting IVs. Now, today, not a lot of text, but I just have some pictures I want to show you. And some place that you can think about starting IVs is digital veins, and this is a lot of times when you're going to look there when you don't see other more prominent IV sites available. So you might look at the digital veins, right? Metacarpal veins, sort of the same thing. Those are like between the knuckles. You don't want to start there first either. You're going to maybe go there if you don't see something much more prominent, right? Now, cephalic veins. You can see here in the picture so one of the cephalic veins that they show here. I have some more pictures I'm going to show you in a second as well. But these are very popular IV sites, right? Next to, let's say, antecubital type sites, right? You can also do things like a basalic vein. Okay, now these are sort of on the border of the ulnar. Okay, and you can see right here where that is located. Okay, it's on the border of the ulnar bone. Now again, an antecubital vein, usually the most common site you're gonna go ahead and see a lot. Where you're gonna go be able to see where the patient's vein is. That's going to be very popular. IV access there. Okay. There's also veins like, inner thigh veins or leg veins. We'll talk about that in a second. Let's just look at some more quick pictures here. Give you a little better idea where some of the veins are located here. And again, you can see you got a lot of nice superficial veins you can access on a patient's arm, right? So you might not see those cephalic veins, you might not see those antecubital veins, but if you know where veins are located, like the basalic veins, like some median type veins on the outside of where the antecubital or cephalic veins are located, it can sort of lead you and have you looking places. So if you don't see antecubital vein, you don't just go right to the hand, right? You're going to go ahead and you'll be able to see it more prominently. Now, another picture here. This picture I like. I filled the entire slide up with this one, guys, because I think it gives you a nice little view here of the veins, and also points out here the antecubital vein here as well. Gives you an idea and lets you know where these veins are. Okay, just keep in mind these are the basilic veins which I mentioned on the outside, right? Your cephalic veins, and of course you have all the veins that are in the hand here as well. Now these are great pictures, guys, and again, good ways to sort of just refresh your memory, guys, and kind of keep in mind where these things are. You know, as paramedics or whatever level you might be where you can start intravenous, it's always a good idea to come back once in a while, just sort of refresh your memory on the locations of all of the venous structures. This way, again, you're not just going for that antecubital vein, you're not just going for the veins in the hand, you're thinking of other veins that are available to you so that you're successful, and then of course, you know, that improves your patient care. Okay, so real quick, guys, I'm not going to show any pictures of this. You know, external jugular, this vein here is one that a lot of people will go for, especially in cardiac arrest patients, right? And also leg vein. Leg vein is sort of a last resort. You know, you got to worry about things like, you know, thrombus formations and things like that. But these days, when you talk about EJs and you talk about leg veins, you know, most EMS protocols and EMS systems nowadays, guys, are using what? They're using IOs, right? Even on adult patients now. So you're not really going to be going for those leg veins. You know, if you have IO, you know, access in your protocols for adults, you're going to wind up using an IO gun before you're going for a leg vein. Okay, because, you know, that's going to be much more beneficial to the patient than giving them an IV like in their foot or something like that, right? EJs, a lot of times still acceptable, especially in the cardiac arrest setting. Of course, you have to follow your local protocols. But again, even the EJs, you know, you might be more concerned about the patient's airway than starting, you know, an EJ IV access there. So you might want to be going and having somebody else using an IO while somebody else is managing the airway at the head of the patient. Okay, so just some quick overviews here, guys. Go back, watch this video again, look at some of the anatomy and physiology here so that you can get a good idea of where you're looking when you're trying to get that IV access on those patients. So this is any patient. This is a good way too. I know I mentioned early on about that 20-year-old athlete, right, with the great veins. Think about the next time you get a patient that is a young individual like that and they have good veins. Compare it to what you're seeing on these slides. Compare it to what the actual anatomy is. And I think when you compare it for what you're seeing here in these quick pictures versus what you see in a live adult, you know, that actually has great veins, you can look. Put that in your mind. Get a little mental picture in your mind and sort of compare it to the actual graphic versus the actual, you know, patient's vasculature. And I think it's going to really bring it home for you, and that's going to help you when you get those patients that aren't as easy to get the IV in. So, guys, I hope you can use these Monday Minutes. Listen, I have a link below to an actual webinar that was done on IV access and conquering some of the difficulties in IV access. Go check that out. It's a much longer webcast that was done, and I think you might get some benefit from that. Be sure to let me know if you have some Monday Minutes of your own. I'm over at emsofficehours.com, and you can let me know there right here below in the comments here, or you can send me an email. My email address is jhoffman@ems-safety.com. And until next week, guys, as always, Jim Hoffman, EMS Office Hours. Stay safe.